All right, well, good afternoon, everyone, and welcome to Trust for America's Health's Age-Friendly Public Health Systems July training. We're very happy that you are joining us today to learn more about how the public health sector can support older adult health and well-being. My name is Megan Wolf, and I'm joined today by my colleague, Dr. Karan Phillips, as well as our colleague from the Association of State and Territorial Health Officials, or ASTO, Dr. Tyrone Bethune. Both Karan and Tyrone are joining us today from beautiful and hopefully sunny Anaheim, California, from the NATO conference. So I need to also mention here that the AFPHS movement, our age-friendly public health system work, would not be possible without the generous support from and partnership with the John A. Hartford Foundation. So we're very appreciative of our partners there. Next slide, please. So we ask that you all please keep your devices muted during the presentations today so we can avoid any background noise or disruptions. And although I'm sure we'll have some time for questions at the end, our session today is an hour and a half long, so a little bit longer than our typical training. So if you can stay for the extra half hour, great. If you can't and you have a question, please feel free to raise your hand or put the question in the chat, and we'll try to get to them as they come. Next slide. All of our AFPHS trainings are recorded and the slide deck is shared with all registered attendees after the training. If you are using an AI note-taking tool, please let us know by commenting in the chat before we begin today. And in addition, you must be present in the training with the AI note-taking tool. Notes generated from any AI tool can only be used for personal use. Next slide. So your feedback is really important to us. So we are asking that each participant take a few moments to complete an anonymous feedback survey that will appear on your screen at the end of the training. Your insights will be shared with our evaluation partner, the New York Academy of Medicine, and will really help us to enhance future trainings. Next slide. So I'm sure that if you've been here before, you've heard us talk about Trust for America's Health, or TFAH, that Karan and I represent. So we are a public health policy research and advocacy organization dedicated to optimal health for every person and community. TFAH produces several reports annually, including our Ready or Not report, which focuses on emergency preparedness, and our Pain in the Nation report, which focuses on deaths from suicide and drug-related and alcohol-related challenges. Related to healthy aging, we have produced reports on many topics, including housing for older adults, rural healthy aging, and the one you see it represented on the screen here, aligning our AFPHS 6Cs framework with this 10 essential public health services. And all of our AFPHS briefs are available on the AFPHS website. Next slide, please. So for those of you who may be slightly new to this work, we have always envisioned since the beginning of AFPHS that there are some very important public health roles in aging, in supporting older adults: preventive and quality health services, social determinants of health, family caregiver support, nutrition and physical activity, and so on. And so the goal of our work is really to elevate and bring in all of these services under the umbrella of public health, but with a lens for the older adults in your communities. Next slide, please. So to do that, we created our age-friendly public health systems 6Cs framework. The 6Cs are because each of the tenets or components of the framework starts with a C. So for example, creating and leading policy and systems change. Connecting and convening multi-sector partners, and so forth. So the goal of the framework is to expand public health roles in aging and to allow all of you as public health practitioners to kind of see yourselves in this work, to see where you can begin to address older adult health and well-being. We want to incentivize state and local and tribal and territorial health departments to adopt healthy aging as a core public health function. And we want to help by building knowledge, expertise, and capacity, and help to advance and sustain important partnerships in this work. Next slide, please. So as part of this work, we worked directly with state and local health departments. And in our phase 2 of the AFPHS project, which began in 2020, so right at the beginning of the pandemic, we put out a call for for applications for state departments of health to come and join us, and we wanted to really work with them to build capacity. We selected the Mississippi State Department of Health as one of the recipients of our grant, and we were so happy that we did. Dr. Keena White in the state of Mississippi really took this work to heart and has led an amazing amount of work in the state. What Mississippi did, they developed an age-friendly public health system statewide work plan. It took several years to develop the plan, and they're now in the implementation phase of it. But this became the ultimate goal for all of our AFPHS efforts. It is an implementation tool for the framework, for the 6Cs framework. But it was developed in a way that reflected the capacity and need for healthy aging practices and strategies specific to Mississippi and within the capacity of the Mississippi State Department of Health at that time. So we wanted to create a structure for capacity building that would then lead other public health practitioners in this direction, developing an agency or state or community specific plan that meets the unique needs of that jurisdiction's older adult population, filling gaps in programs, leading to the development of new partnerships, and leveraging departmental support wherever it exists. Next slide, please. So TFAH partnered with 3 public health organizations to develop the AFPHS 6Cs Training and Implementation Guide because we felt that these organizations would know best what state and local health departments might need. So those 3 were the Association of State and Territorial Health Officials, which Tyrone represents, the National Association of County and City Health Officials, as well as the National Network of Public Health Institutes, because we have been working with NNPHI to develop the capacity of 10 state PHIs to do this healthy aging work. So that's what we did. We enlisted the help of these folks. We started in April of 2023 to start the development process for this work for the guide. We thought we were going to be developing a curriculum, but it turned really more into a training guide. We were really proud of what happened and the way it has come about. So I'm going to talk about a little bit more about that development process in just a moment. If we can go to the next slide, we'll take a look at the purpose and the goals and the methodology. So the purpose of the guide is really to just increase knowledge and expertise in understanding what the public health roles are in improving older adult health and well-being. And the ultimate goal, as I mentioned, is the development and adoption of statewide or local jurisdiction-wide AFPHS plans. Also to build a team or a cohort or a cadre of public health practitioners who are AFPHS experts, who are experts in healthy aging. And as I mentioned, our methodology was partnering with the 3 national organizations, and then we piloted the guide with those 10 state public health institutes. So next slide, please. So we piloted the guide as we were building it. So with the 10 PHIs in the AFPHS cohort, so we worked with ASTO and NACHO and NMPHI, and we would build one module and then have the PHIs pilot it. So we would provide them with some training, ask each of them to use the guide, and then to give us some feedback. So as I said, this process began in the spring of 2023, and the piloting of all 6 modules was completed in January of this year. So throughout that development process, we received feedback from each of the PHI teams and incorporated that feedback into our revision and approval process at TFAH. We also made changes along the way to be sure that the content was up to date and reflected changes in the availability of some of the resources. And we also wanted to be sure we were keeping in mind all the time that Mississippi plan, as well as aligning where we could with the 10 essential public health services. Next slide, please. So to get started in just kind of looking at the guide, this is on our AFPHS website. And Karan, could you pop the the address or the link to the AFPHS site in the chat. That would be really helpful. So you need to go to the AFPHS website, and then the guide right now is the first item on our main landing page. So if you click on that, then you'll get to the page that you're seeing now. But you can also access the guide from the tabs at the top of the page, the one labeled AFPHS Framework, and that will take you right to this page. You can see that there is a navigation menu on the left side of the page, and you can then jump around from the overview to the introduction to any of the modules. And again, each module aligns with one of the 6 C's of the framework. Next slide, please. So the guide starts with an introduction section that includes narrative content on making the case for developing and implementing an AFPHS plan. So it provides a lot of background information on aging in America and on the need for public health engagement. So this is information that you can take, you can cut and paste it and put it into any documentation that you may need to justify spending time in this guide and developing your expertise in healthy aging. It also provides guidance on why and how you should create an internal team and an external advisory committee, as the Mississippi State Department of Health did, because these 2 teams kind of help you. So the internal team will help you identify your priorities, identify the steps that you want to tackle. The external team can provide some guidance on external partnerships that can help you implement the different pieces of the plan as you develop it. We've also provided how-to instructions and a separate document or guide on how you can operationalize an equity approach as you develop your capacity for this work. And Tyrone is going to be spending a little bit of time on that section with you all today. Next slide, please. So each of the modules, when you go to module 1, module 2, module 3, etc., each one includes a brief introduction. Each one has its own set of learning objectives, and then a tiered list of strategies, practices, or activities within each of the 6 C's. In addition, modules 1 through 3 include a competence check, which is really just a way to reflect on what you're learning and where you want to go. And it also provides an opportunity to check back with us if there's more you want to learn about an area, or if we can help provide some additional guidance or technical assistance on a specific strategy. And then for modules 4 through 6, we developed an activity for each module to put what you're learning or what you've learned into practice. They're not difficult. They're just really a way to kind of think about taking a strategy and thinking about how you would put that into action. Each module also includes recommendations for partnerships, data collection, and what I am most excited about, and that is the list of resources and tools and toolkits and research that are aligned with each of the suggested strategies and activities. And I'm getting ready to show you what that looks like for each module in just a moment. But first, let's look at how to use. Let's look at our how to use guide. Next slide, please. So our how to use guide is pretty basic, but we help you think about who should use the guide. So we are suggesting that public health leaders and staff, but you can also engage with community partners. I think it would be really valuable for a team within your Department of Health, or if you don't represent a Department of Health, whatever type of organization you do represent, have a team work through this process together. But also, it could be very helpful for anyone who wants to build expertise in healthy aging, again, because of that extensive list of resources that we provided. And then why? I think I've answered that question a little bit, and our introductory narrative will also help to answer that question. But the guide, the whole process of the guide and all the information in it will build your capacity and your expertise and your understanding in the need for public health action and prioritization of healthy aging, but also access to resources. If you do nothing else, if you just take a look at the number of resources that we've put together, I think that you'll find it valuable. and how to complete the guide. So how should you tackle it? Where should you start? We suggest starting with the introduction, at least skimming through it so you have a sense of kind of the what it's all about and where you should go, and it might give you some additional ideas of partners, or who how you want to prioritize the work, or how long you think it's going to take. It's a really good place to start. We also suggest that you start with module 1, just because that one is on creating and leading change, and that's really building the capacity for leadership and for championing the work that you're getting ready to do. The guide has different levels. Each module has a guide. Each guide has different levels of activities based on how challenging they are. So they have a tier 1 and a tier 2. Tier 1 are the less challenging activities, and tier 2 are the little bit more challenging, but all really valuable. And then the reflection time, completing those competence checks or doing the activities is a really good way to make sure that you're really being thoughtful and kind of going through the process in a thoughtful way. Okay, next slide, please. Okay, our guide has learning objectives, as I said, for each module, but these are the overall learning objectives. And for example, if you need to develop a justification for your agency to complete the guide, or to go through it with a team in your agency, these learning objectives might be really helpful for you. So we just wanted to make sure that we provided that, but also we spent some time, thinking through what would be helpful and what we hope that you get out of it. And that's where these learning objectives come into play. Okay, next slide. And I think that now we're going to be getting into the actual modules. So, okay. So first of all, before we get into module 1, each of the modules has, as I said, these strategies that are laid out that provide kind of a way for you to go through it. Each of the guides and each module have, again, specific learning objectives. We have suggested steps for you to follow as well. For example, we may have 20 different strategies in module 1 or 25 in module 2. We're not suggesting that you attempt to commit to all of those. We suggest that you identify 2 or 3 strategies to explore, potentially just starting in tier 1, but potentially also going into tier 2. We provide some questions to consider for each strategy. So if you identify 3 strategies in module 1, take a look at the questions and go through them and answer them with your team or on your own, and look at the next steps for those. And then take a look at the strategies and tools that are provided for, take a look at the tools and resources that are provided for each strategy. That will help you think about how your team or your agency can move forward on that. And then there's an opportunity for you as well to think about what other public health strategies might be achievable and sustainable within each of the modules. We're not suggesting that the strategies and activities that we have identified are exhaustive of addressing that tenet. We've just pulled together what we've seen other health departments do, and what we are suggesting would be really valuable to be able to accomplish objectives within a particular module. Okay, next slide. All right. Here's module 1. I know this is hard. This is hard to see. It's small. But if you go to the website and click on one of the modules, you'll be able to draw this down. I just wanted you to be able to see what you're going to see when you click on module 1 and you click on the actual guide. This is what will come up. So what you see here is a brief description. It'll have a definition, the learning objectives for that module, and then the policy and practice strategies and instructions of how to use that. Can you advance one more? And that'll bring in what that looks like, what some of the strategies look like. If you'll advance the slide. It should be an animation. There we go. So for example, in module 1, Here you see one of the policy or practice strategies under Tier 1 is to join, create, or expand a state or community coalition or task force on healthy aging. Okay, this is a strategy that is aligned with the first tenet, which is creating and leading change. One of the best ways to create and lead change is to participate in a coalition where you can begin to influence the activities of that coalition. Okay, so that's the strategy. Then in the middle, you see the questions to consider. Is the state already engaged in, or state or community or county already engaged in developing or implementing a multi-sector plan for aging? If so, who are the leaders and partners in that effort, and kind of think about who those are. So there might already be a coalition in your, if you're at the state level, a coalition in your state that's working on a multi-sector plan for aging. And then there are other questions there for you to think about. And then in that third column, you see that there are links to resources, developing a multi-sector plan, learning about collective impact, learning about, I can't even read some of it from here, but you see what I'm saying. It's like that you've got, so with each one you have your strategy, you have your questions to consider, and then you have all these wonderful resources. The fourth column we've left open for you to either take notes in or to indicate that that's a strategy that you have selected if you want to go about that in a more formal way. Okay, so that's module 1. It's several pages long, and when you get to the website and you click on module 1, you'll see that. And I forgot to include this, Karan. So for each module, when you go to it, there will be an introductory video that Karan and I have created to help you learn about it. There will be the guide, there will be the competence check, and there will be, I feel like there's something else. Karan, jump in here because I'm forgetting now. I'm not looking at the website. I feel like for each module, there are 4 things.
So we have the recording, the slides, and
Thank
then
you. That's it.
Yep.
Right. Thank you. So the recorded training, which you can click on and view, they're really only about 5 to 7 minutes. The PowerPoint that accompanies that training, that video, and then the guide, and then the competence check. So modules 1, 2, and 3 have all those pieces. Modules 4, 5, and 6 have slightly fewer clicks for you. Okay, let's go to module 2. Oh, there we are. Okay, I guess I separated them and didn't realize I did. All right, let's go to the next one, module 2. Okay, oh, here we go. Sorry. So modules 1 through 3 have a competence check. This is just a picture of what the competence check looks like. So you have a question that we're asking you to be able to define and provide an example of creating and leading of change, and that's relevant to your work. So it's pretty short. There are only about 8 questions for you to think about and respond to, but we feel like it's really a way to think about what you've been processing and what you've been going through, walking through for module 1. Okay, next slide. Okay, module 2. Module 2 is on connecting and convening partners in this work. Some of the strategies here include, for each of the modules, we have tried to include the example from the Mississippi AFPHS statewide plan. So you'll see that, and then you'll see a link to the Mississippi plan. So you can always go back and reference what Mississippi did, because that is a plan that's actually being implemented. But then we have additional thoughts, additional strategies that we provide, like exploring and engaging in new partnerships to promote healthy aging, like partnering with an area agency on aging or a state unit on aging, or community cooperatives or others. And then again, more questions to consider and more resources to explore. So module 2 is all about partnerships and thinking about the partnerships that you may want to engage with. Next slide. So module 3 is on coordinating existing supports and services. So what this means is a public health department can can use their website or other types of resources and capacities to think about what are all the existing ways that a community or a state is supporting older adults, and how can the public health department help to coordinate that. So for here, I've given an example of a couple tier two strategies, including adapting existing tools to assess agency programs that support older adult health, and to use those results to engage leaders in healthy aging efforts. So, for example, there are different survey tools that you can take advantage of, including AARP's survey tool, NACCHO's community assessment tool that's called MAP 2.0. You can use those to assess what are all the programs that already exist in your jurisdiction that support older adults, and what other partners can you bring in to engage in that, and are there other connections, or are there other tools that may exist to help you do that. And then the next strategy on within Tier 2 for Module 3 is engaging health systems in your state or community to provide care coordination for older adults. So again, thinking about that, that's a pretty challenge. It could be a challenging step if you don't have a relationship already with your health system. But again, questions to consider, and then additional resources to explore. And particularly for this one, I want to highlight the resource there that you see in the third column of the 3 keys to cross-sector age-friendly care. That's something that TFAH developed in partnership with the Institute for Healthcare Improvement to really think about a coordinated care journey for older adults, and how public health departments can partner with healthcare systems and hospitals to create a more seamless care journey for older people. So one of my favorite resources, I'm really glad we're able to include it here. Next slide. The module 4 is on data, so collecting, analyzing, and translating data. And here we have a couple of examples, including exploring examples of other data dashboards that comprehensively address older adult health. And here we like to point out in the resource column. Let me go back for a second. Okay, so for module 4, 5, and 6, we don't necessarily have the questions to consider. We have the strategy, and then we have the resources. So this is a slightly different approach from modules 1, 2, and 3. But we wanted you to be able to kind of jump right in to looking at what some of the resources are. And then and kind of think about where your jurisdiction is. Do you already have a data dashboard? If you don't, take a look at some of the ones that already exist and see what it takes, explore what it takes to create one in your jurisdiction. And then next slide. You can see the example of, I thought we had our, okay. I'm forgetting what we put on these slides here. So what I wanted to be able to show you was the example of the activity that we have associated with Module 4, but you can go on the website and pull that out and see it really quickly. So Module 5 is on communicating public health information. Again, here on the left column, the strategies such as exploring public health communication strategies that are already being used in your jurisdiction, and kind of pop in those links where available. How can you begin to use those to support healthy aging, to communicate with your partners, to create an age-friendly plan, or to communicate directly with older people to solicit information about what would be helpful and what would be a priority for them in your community. Another strategy here is to identify key Department of Health personnel to target for communicating about adopting and implementing age-friendly public health system policies and practices. And again, some suggestions on who you might connect with: state health officials, chronic disease program directors, and health equity personnel, and so forth. Again, many strategies on communicating, how to, some suggestions on partnerships, and so forth. Next slide. And Module 6 is on complementing existing public health programs. So this tenet, our 6th C, is really thinking about what are those public health programs that are already being administered in your jurisdiction, and how can those be expanded to include older adults? Or how can you, take an aging lens and apply those to those existing public health programs? So here, one of the strategies is to identify all the government agencies in your state or locality that may have a connection with older adults, including housing, transportation, justice, etc. And we have some resources there that can help you to do that. One of the strategies also is to review the Denver Regional Council of Governments Boomer Bond Assessment Tool. So this is a tool that it actually helps you to walk through all the agencies in your jurisdiction and be able to document what are all the programs that that could touch or are touching older adults. It's a really good. It takes some time to do that, but it's a really good place to start to be able to identify gaps in programs and services and where you may want to adopt some programs or adopt some strategies to begin to fill those gaps so that older people no one's falling through the cracks and none of those services are falling through the cracks. Next slide, please. Okay, so here's where we have an example of the application component. This is the module 6 programmatic review. So what we've simply done is just built a template for you to be able to use. This is very loosely based on the Boomer Bond Assessment Tool from the Denver Regional Council of Governments, but you can see that there's a column for programs, there's a column for the program area, and then agency, and then partners. So we just encourage you, if you're going to do this, to be able to take this and kind of adapt it and use it on your own. We're not asking that you send it to us. However, if you want to complete any of the activity components of modules 4, 5, and 6, and then send them to us, we're happy to take a look. And Karan and I are happy to meet with you to review any of this work and any of the application pieces that you will be completing. Okay, I think if you go to the next slide, and I think that is, yep. I'm going to stop there for just a moment and see if there are any questions from anybody. It's a lot of content that I went through pretty quickly. So maybe 6 include the 4M age-friendly health system principles. Yeah, I'm sure that we have, Don, I'm sure that we've included the 4Ms someplace in those resources. I don't know exactly where it is at this point, but that's an interesting idea to include that in module 6. And that reminds me that Karan and I and others in TFAH and our partners as well will be continually reviewing the modules. And so that if you come on something, if you come on a broken link or a strategy that doesn't make sense, or you think of additional strategies, please let us know, because we want this to be an ever-growing document, one that we will continue to perfect as we move from our current phase into our next phase of work. We're also working on a new designation for health departments that complete this guide. We haven't launched that yet, so I don't want to say exactly what that looks like, but keep that in mind as you're thinking about whether this is something that you want to do in whole or in part. And honestly, if you do even a part of it, I think that you'll find that it'll be valuable for you. So I will stop there and see if there are any other questions. Okay, great. Not seeing any or hearing any. I'll stop now and I'll turn the platform over to Tyrone.
Thanks, Megan. Happy to take the mic. Welcome, everyone. I hope you can hear me. And we can get started in our journey to operationalize health equity. If you're not familiar with ASTO, just wanted to pause for a moment to share more about the organization and our work. ASTO is a nonpartisan organization and the collective voice of the nation's health officials. Its members are the chief health officials of the 59 freely associated states, territories, as well as Washington, D.C. And as you see, our mission is to support, equip, and advocate for state and territorial health officials in their work of advancing health and the public's well-being. Next slide, please. I also want to recognize the team that supports this work, from chronic disease and community design to equity and healthy aging. These are the folks behind the scenes driving impact across states and sectors. Um, we are led by our Senior Director of Chronic Disease, Health Improvement, and Healthy Aging. That is Erin Bayer. The Health Improvement and Healthy Aging Director is Talia Sims-Levitt, another face and name that you may be familiar with, followed by myself and Kelly Waugh. We are super, super happy to be involved in this work and really value our partnership and relationship with our TIFA partners in partnership with Trust for America's Health. ASTO helped develop the Six C's training and implementation guide to help departments expand their role in promoting equitable aging across the lifespan. I would be remiss if I didn't share this plug. Pausing here to note that ASTO's recognition as a national organization, receiving the first designation as a national organization to receive the age-friendly recognition. So just wanted to pause and make sure that I share that we were the first national organization to receive recognition. Next slide, please. Next slide. All right, so just to provide some additional context, our team takes a both and approach to healthy aging as it relates to a public health topic, meaning we prioritize both the healthy aging and older adult health approach. The healthy aging focus is overarching. I'm thinking about what public health can do to help people age healthily throughout the life course and reach older adulthood as healthy as they can be. Once people reach older adulthood, we also want to strengthen the public health role to support that population's health. Um, we are especially interested in partnerships between public health agencies and state units on aging. I will also share that we frame toward the positive, meaning we want to see equity in aging well across the lifespan and life expectancy across groups. And we can get there by promoting healthy aging and older adult health. Next slide. Wanted to share a couple of models that help conceptualize and kind of reimagine the social determinants of health framework and how they are layered into the six C's. Just pausing to really think about the non-medical factors that impact the ways in which we age, dissecting the root causes of health disparities. Health doesn't start at the clinic, it starts in a home, it starts in our neighborhoods and communities. And so on the left, you will see the social determinants of health framework. And these are the conditions in the environments of which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functionality, and quality of life, thinking about health outcomes and risks. These conditions can have a profound effect on a person's health as they age, including the risk for chronic illnesses and Alzheimer's disease and related dementias. Health inequities continue to persist because of policies that have systematically limited access to healthcare and other opportunities. Public health professionals can assess how social determinants of health impact older adults in their jurisdiction to inform strategies that advance health equity. Looking to the right, as an example of the types of strategies to address the impacts of social determinants of health, we have the seven vital conditions for well-being. And this is a very useful framework for conceptualizing holistic well-being and the conditions that give rise to it, as well as identifying the levers for community change and improvement. The framework brings together the major determinants of health and exposing how parts of a multifaceted whole work system, I'm sorry, a multifaceted system work as a system to produce proper population well-being. Next slide, please. And so at ASTO, we've created a vision and approach for health equity. And that definition reads, occurring when everyone has a fair and just opportunities to be just as healthy as possible in society that values each member equally and through focus and ongoing effort to address avoidable inequities, historical and contemporary injustices, and the elimination of disparities in health and healthcare. And so achieving this requires ongoing societal efforts to one, address historical and contemporary injustices, overcome economic, social, and other obstacles to health and healthcare, and three, eliminate preventable health disparities. And to achieve health equity, we must change the policies and systems that have resulted in the generational injustices that give rise to it, to race and ethnicity, ability, and other factors. And moving down, the operationalizing equity, really why we're here today, really thinks about replacing the absences and barriers with solutions to addressing an imbalanced social system. And taking that a step further, that operationalizing health equity, that definition, simply put, is putting health equity into action. Next slide, please. No matter where we are in our journey to operationalize health equity, barriers and opportunities show up, which are also woven throughout the training. Public health plays a role. Given our position as strategic conveners, as well as our engagement with multi-sector partners, public health professionals are well equipped to influence policies and system change to promote older adult health and well-being within their jurisdictions. In order to implement these activities, public health professionals should assess what barriers exist within their jurisdiction that may prevent them from enacting systemic change. Throughout this presentation, we'll share some opportunities that public health professionals can take to address the challenges that they may experience and their efforts to create and lead change. I think it's important to share that in today's comment, it's important to frame health equity as a commitment to fairness, effectiveness, and smart public health, not politics. You've heard in our definition at ASTO, but I do want to take a moment and make space for the intention behind this work. Framing equity this way shifts the focus from blame to solutions, emphasizing how changing policies and systems help eliminate preventable disparities across race, income, geography, and ability. And so by operationalizing equity, we are not just naming the problem, we're actively replacing the gaps with strategies that overcome outcomes for all communities. Next slide, please. As Megan already discussed in her portion, just wanted to share that the guide does provide capacity building strategies in several areas, and ASTO work closely with our partners on developing sections on operationalizing health equity and understanding the barriers and challenges. The guide offers a practical tool for reflection and implementing planning to advance healthy aging and inclusion of older adults in state and local public health practice. And so, in the next couple of slides, I'll take a moment to illuminate this intersection between 6Cs and health equity, and you'll see how you'll use this work as well as questions to help you think about how to strategize and leverage this very rich information. Next slide, please. The 6Cs framework places health equity at its core, aiming to dismantle disparities that disproportionately affect marginalized older adults. Here are a few suggested steps to take in your journey to operationalize health equity. Step one, using data that is disaggregated by geography, age, income, and other relevant factors other relevant factors help us identify where health gaps exist and where additional support may be needed. This isn't about politics, it's about using data to improve the reach and effectiveness of our programs and ensure no community is overlooked. Step two, we want systems that work together for all people. When we approach policy with a fairness lens, we can reduce barriers and expand access in ways that strengthen families and communities, whether that's improving access to support and caregiving, enhancing public health infrastructure, or supporting aging in place. Next slide. And step three, the most sustainable solutions come when we involve a wide range of voices, especially those closest to the issues, partnering with community organizations, caregivers, rural leaders, and others that help ensure that strategies are practical, grounded, and widely supported. And step four, effective communication means meeting people where they are with language, with tone, and content that's understandable, respectful, and relevant. This helps build trust, improve public awareness, and ensures that health information reach everyone who need it most. Next slide. Operationalizing equity means moving from intention to impact. That begins with understanding the root causes, the structural and cultural forces that drive disparities among older adults. Um, what historical policies, economic shifts, or systemic exclusion have shaped the way people grow? I'm sorry, the way people in your community age. This includes access to housing, transportation, social support, and healthcare. We also need to examine where equity work is already happening. Can we align with existing age-friendly efforts? Can we strengthen what's already in motion rather than starting from scratch and being more duplicative? Another key strategy is to address ageism, not just in the health system, but in how society views and values older adults. That includes creating respectful narratives and investing in services that support older adults as whole individuals. Equity requires sustainable, affordable, and cultural appropriate services from long-term care to caregiver support. And these aren't extras, they're essentials. They're essentials for public health impact. Next slide. And so, at a very high level, here are some of the questions to help guide your work in creating age-friendly and age-inclusive communities. These questions are also planted throughout the training. Um, these questions are meant to spark localized, practical planning. First, can your jurisdiction disaggregate data on older adults? If we see the disparities, we solve for them. What social determinants of health matter most in your context? For some places, it might be access to care, and others, you may see safety, food insecurity, or housing instability, which might be the larger drivers. Think critically about what's showing up in your data. What's missing? For example, are rural communities underrepresented? Underrepresented? What about linguistic or cultural minorities? To change systems, we also need to identify partners and champions who can shift perceptions, especially around ageism. We can include faith leaders, caregivers, local business owners, and older adults themselves can be powerful advocates. Next slide, please. Operationalizing equity often means navigating internal barriers, and that starts with addressing silos. Many agencies function in isolation, which can slow momentum and duplicate efforts. And so, healthy aging priorities must be embedded in state and local health improvement plans. They shouldn't be treated as side initiatives, but integrated as part of core public health work. Next, take stock of how your data is used. Is it guiding decisions? Is it telling you who is being left behind or only confirming what's already known? Burnout is another critical barrier. Equity work is long term and relational. We need to invest in our teams by building resilience, offering support, and reinforcing a sense of shared purpose. Lastly, equity requires policy and system change. Public health leaders must be at the table when laws, budgets, and regulations that affect older adults are being shaped. Next slide. And so, how do we translate strategy into reflection? Where do silos exist? Within your agency, between your agency and others? Where could collaboration be strengthened? If older health isn't in your jurisdiction's health plans, ask why. What's preventing it from being elevated? What is it a data issue? Is it a leadership gap? Competing priorities? Um, Data is only powerful if it's being used intentionally. What sources are you using now? Are you capturing the right indicators like access to caregiving resources, cognitive health screening, rural aging needs? Um, and don't overlook workforce capacity. Does your staff receive the training they need? Is it a niche topic? Um, Is public health woven into your initiatives? And this isn't about adding to everyone's plate. It's about building a foundation that helps community age and age well. Next slide. All right. And so I would like to leave you with some essential takeaways to remember in your efforts to operationalizing health equity, understand and overcome barriers and challenges. Center health equity within older adult health and healthy aging initiatives. Lead multi-sector collaboration to address those social drivers of health, including housing, transportation, access to high quality health services, leveraging key players and systems, thinking about relationship building, inviting the community as a player, involving your state health officials, legislature, taking that life course approach throughout your educational systems, whether that's higher education, public education, thinking about how to include public safety, include older adult health and healthy aging in state health policies and plans, um, improve data best practices such as disaggregating data by race and ethnicity, mobilizing data for action, really strategically and intentionally collecting data to frame the health concern, allowing the data to inform program development, allowing your data to help with grant opportunities, workforce development, research studies, policy alignment, state health assessments, and your improvement plans. Next slide, please. And before I pass the mic, I did want to close by sharing information and additional resources. Um, I invite you all to use this QR code to visit ASTO's Healthy Aging Older Adult Health webpage. Additionally, please reach out at our Healthy Aging inbox, Healthy Aging at ASTO, if you would like to be connected with our team. But we're happy to support you on your journey of champion positive health outcomes for all across the lifespan. Thanks for your time.
Thank you, Tyrone. Thank you so much for that really, really helpful presentation. And for those of you who are still with us here, we will, I think we're going to figure out a way to post a link to this recording on the guide page. In addition, we'll be sending it to you, but want to make sure that you have access to all this great information as well. So the PowerPoint and the link to this recording will be on the guide page. At least I'm hoping we'll be able to do that. So we have plenty of time here because we did allocate the extra half an hour for this training this afternoon. So if anyone has questions or suggestions for us as well, we would love for you to come off mute and open up your camera so that we can discuss with you and learn from you as well. So I'm happy to hear from all of you or any of you if you have questions or suggestions for us. Well, if not, we really appreciate your time this afternoon. Highly recommend that you at least stop by the website and take a look at the guide, kind of walk through it a little bit so you can get familiar with it. As we move through our work at TFAH with age-friendly public health systems, we are going to be thinking about how can we maximize all the great information that's in there. So stay tuned for opportunities to partner with us to learn more and to become very strong experts in healthy aging work. Again, please let us know if you have suggestions for the guide, for updating it, for improving it. We are completely open and really appreciate your expertise and your suggestions as well. So Karan, if you want to pull those slides back up and I'll let you wrap us up.
Well, thank you, Megan, and thank you again to our dear colleague, Dr. Tyrone Bethune. Wanted to share that if you just happen to be at NACCHO, we are closing out our booth in a few hours, but if you want to stop by, I will be headed there shortly to greet you and to, again, talk more about the guide and talk more about some other things related to the work we're doing related to age-friendly public health systems, and that's booth 523. So for next month, our training will be on August 21st at 3 p.m. And again, you can register for that under the events section of our website, afphs.org. And if you are pursuing our champion recognition, if you again are trying to view 6 of our monthly trainings, please pause the recording if you're viewing this recording, or if you are viewing this live, please navigate to the QR code or use the web address on the screen to indicate that you have viewed this training so that we can include that in the count to get you closer to becoming an APHIS champion. And I'll pause for just another few seconds. And again, thank you everyone so much for joining us today. We look forward to seeing you all next month. And if you happen to also be planning to travel to APHA, we will also be there in person as well. So we welcome opportunities to meet you in person. Have a good afternoon.